Today we're doing a very cool treatment for Crystal. We're doing PRF injections to the tear trough. And this is a great treatment for someone who doesn't have significant hollowing or bags, but is having some skin related changes, usually UV radiation induced changes to the quality of the skin underneath the eyelid. So you may see some darkening or pigmentation of the skin underneath the eyelid. These are all great indications for PRF injections underneath into the tear trough. So this is different than a typical filler. So like a hyaluronic acid filler such as Restylane, which we do inject underneath the skin in the tear trough region, which is this region here. But there are limitations with it. It doesn't do anything for the skin quality in that area, and that's where PRF comes in. This is a great treatment because it is all natural. What we do is we draw your blood when you come in, and we take the blood in a vial and we centrifuge it. We place it in the centrifuge, let it spin at 1100 RPMs, and it separates out the blood into different components. We then take the component that has the platelets and the fibrin, and that is what we actually inject back into the skin. So I think of it as a super concentrated solution of platelets that signal the body to heal, to regenerate. So it's sort of a regenerative medicine type procedure. Very nice because it's easy to do, it's quick to do, and can get you some very nice results that traditional fillers can't do. We inject just a small spot of lidocaine in the cheek, and this just helps with comfort. We'll have the patients numb with a little bit of topical numbing medication as well, but honestly that's not super important because it's not a very painful procedure, especially once you have that little bit of lidocaine that I just injected in the cheek. One of the really nice things about PRF is that it's an all-natural alternative to traditional fillers, so the hyaluronic acid fillers. Those are actually synthetically made in a lab. Although hyaluronic acid is a sugar molecule that's found naturally in the skin, it is the stuff that we're actually injecting is synthetically made. This is all natural, it's all you. There's no additives, there's no preservatives, there are no activators. It is purely your blood that has just been super concentrated, and we just grab the part of the blood that is going to help rejuvenate the skin. I like to kind of spread it out, because we only put it in one area. And then tonight, you need to just sort of take it easy, okay?
Okay.
Yeah, so this is a different type of treatment when compared to the traditional hyaluronic acid fillers. That's usually an instant gratification type procedure. You place the filler, you see a pretty immediate result. Of course, it'll change a little bit over the ensuing weeks, but you get a good idea right off the bat. This is different. This, you're gonna inject it, there's gonna be a little bit of swelling and fluid underneath the skin for several days. Then that sort of goes away and you'll kind of go back to your baseline, but over the ensuing weeks, your body is going to be stimulated to improve the quality of the skin in that area. This is not a get-rich-quick scheme or procedure. It takes a little bit of persistence and time to actually see the rewards from what we're doing. And so for that reason, you have to repeat the procedure multiple times. Usually we space it out about every 4 to 6 weeks. And I traditionally recommend 3 to 4, a series of 3 to 4 treatments, up to 6 treatments, depending on how good of the results that you are getting.